Right, we're here today with Courtney, and she's in because you've been having some chronic headaches as a result of a herniated disc that you suffered in a car accident a couple years ago.
Yes.
Tell us a little bit about, the after effects of what happened from the car accident and the herniated disc, and just walk us through, 2013 with the motor vehicle collision and how it's affected your headaches and your neck.
So basically, I got into a car accident at the end of 2013. I had a woman rear end me, which gave me a little bit of whiplash, and went to get some chiropractic care, went to get an MRI, and I learned that I had 2 herniated discs in the upper part of my spine, and my headaches just started coming shortly after that. I find no relief from over-the-counter medication. It's just been hectic for me because it affects my everyday, daily life. So hoping to get some answers and resolve some issues.
Good. So let's see if we can get you some relief today. I just want to check your muscle strength, and we're going to check to make sure your dermatomes look okay. And then we'll proceed with some treatment today to see if we can get your pain down a little bit.
Great, sounds great.
Good. Everything looks pretty good there on the left. Good. Good. Pretty healthy reflexes. Good. And you're not having any numbness in the arms or any weakness. Okay.
No, it's
good.
mostly up here.
Okay. Let's check it. Does this feel normal?
Yeah.
Good. And what about here? Does that feel the same on both sides? Let's hold your hands out. Good. Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
What about here?
Mm-hmm.
Good. That feels normal?
Yes.
Good. Let's see, we're going to hold your arms up like this. Good. Don't let you press down. Nice and strong. Good. Then we're going to come here. Don't let me push down. Good. Don't let me push up. Good. And let's flip your wrists up. Good. Don't let you press down. Keep them up nice and strong, like you're starting a motorcycle. Good. Do you ride motorcycles?
I don't.
No.
I'm terrified of them.
Good. And then squeeze here. Grab my hand. Good. Same thing here. Squeeze. Good. Okay. So yeah, your muscle strength is okay. There's no decreased sensation.
Okay.
You probably still have some after effects of the herniated disc. Most of them get better over time, but they're never the same. They like to kind of flare up and cause this chronic neck pain and headaches that you're having. So, way up. Good. Loudly here. Good. So you're pretty tight up in your upper thoracic spine. I take it you do a lot of weight training, is that right? Or okay.
Yeah.
So we're going to do an adjustment on our lower cervical spine. Right here at C4, C5. Good. Very good. And we're going to get the upper cervical spine, C1, C2. Feels very restricted. Good. Just going to be a little stretch. Good. Very good. Any pain when I press in here? No. Good. Let's see. Good. Very good. Wow, that was a loud one.
Yeah.
Let's take a look at your back and pelvis. So what I like to do is adjust your sacroiliac joint and your lumbar spine on this left side here. Can you lay on your side, face me? Good. We're going to bend this top leg here. Good. Very good. Cross both arms. I'm just going to let this fall back. Good. Very good. And let's go on the other side. Relax your shoulders back. Good. Good. So she's a little restricted here in the sacrum, and then right here at L1, L2. So we're going to go in, push those joints forward and up. Good. Very good. Good. And let's see. Let's go face down again. Do you get pain when you exercise?
Sometimes afterwards.
Sometimes
yes.
afterwards. Okay. Going to have the chiropractic assistant come in and run a little muscle stimulation over the top of your back to bring down some of the tightness.
Okay.
So just relax. She'll be in just a moment.
Okay, thank
Yep.
you.
Up, and it looks like you're doing a lot of shoulder work,
Yeah.
and as those get really tight, I mean, they attach to your neck, so it can kind of irritate your neck too and cause a headache.
I do
Just,
feel after I do strength training, especially upper body, I do feel the next day, not like a chronic headache, but I do feel a lot of tension, and I never really related the two because I always felt sore after I worked out, but yeah, it's just very
you
random.
definitely don't want to stop exercising, but
Right.
just be really maybe work with a trainer, and
Okay.
also as much as you work on your muscle mass too, work on your flexibility as well.
Right.
With your history, having when you get this really tight and built up, it could cause some headaches to start too. So.
Okay. All right.
So there you have it, folks. It's a full spine chiropractic adjustment for headaches, neck pain, and upper back tightness. Until next time, thanks for watching.